Good morning, Facebook. This is Bill Paravano, the Knee Pain Guru. I got some questions yesterday on knee pain that I'm going to get to in just a moment on arthritis, bone on bone, bakerscyst, and avoiding knee replacement surgery. So I'll get to that in just a moment. For those that are watching this, post your questions. This is going to be posted on Facebook. If you got any questions about your knee pain, what you're dealing with, just post them on the Facebook page. Go to the Knee Pain Guru. Do a search on Facebook for the Knee Pain Guru, and you can post your question on there, and I'll be answering these pretty regularly. And of course, share this video with other people who are suffering with knee pain. They're limping around. They're easy to spot. Anyhow, okay, so we got two questions here. One is from Susan, and Susan asked, I posted yesterday, I was in the mood to answer knee pain questions live, so she responded, and she said she's trying to avoid knee surgery for bone on bone. I'm assuming she means knee replacement surgery, because not all knee surgeries are created equal. Some knee surgeries are arthroscopic. They don't actually open up the knee. When they do patella, when they do ligament reconstruction like I had, they open up the knee, which is more invasive than just the arthroscopic surgery, which is keyhole surgery. And then you have full-blown knee replacement surgery, which they cut off the bones in your leg and replace it with plastic and metal. So I'm assuming because she has bone on bone that that's the type of surgery we're going to be trying to avoid here. She says, she continues on, the knees haven't always hurt, even after the diagnosis. I think the pain is from inflammation. Any comments? All pain, well, whenever I talk with someone that is diagnosed with arthritis, bone on bone, that type of situation, what ends up happening is the only reason we're really talking is because they have pain, not because of their diagnosis. So the pain is the reason why they're speaking with me or they're speaking with their doctor. Now, it's good to get that diagnosis to know what you're dealing with. However, in terms of, like, honestly, if I asked 1,000 people that had bone on bone in their knees, would they care what their diagnosis was if they didn't have knee pain? And 999 times out of 1,000, they would say no, they wouldn't care what their diagnosis was. So the real issue that we have to deal with is the pain. So when we look at what the source of all pain is, especially in the knee, or I don't know, the Knee Pain Guru, so we're talking about knees, we have to look at there's nerves in the knee that are being irritated, that are being squeezed or rubbed in some way, that throws the body in what I refer to as a pain tension loop. When the body is in a pain tension loop, it's stuck. It feels pain, it tenses up to protect itself. That tension reduces the space in the joint. The reduction of space irritates the nerves more, causing more pain. So the more pain you feel, the tighter the joint gets, the more pain you feel. And you're stuck in that loop. And this is what happens with anyone with arthritis, bone on bone type of scenario. They're stuck in that pain tension loop. And the key is to interrupt that pattern, interrupt the pain. Now, from a medical perspective, what they're trying to do is give you something that will numb that experience in your knee so you don't feel it. And they're hoping, they're like, fingers crossed that when that stuff, the drugs, the shots, whatever it is, wears off, that the pain's going to be gone. So it's kind of like a crapshoot. They're like throwing the dice and hoping that when the nervous system doesn't feel the pain for a period of time because we've numbed what's going on, that on the other side of that, the pain may or may not be gone. And many times it doesn't work. So that pain tension loop is still there. It still exists. The joint gets tighter, the joint wears. The key here is creating what I refer to as pain pattern interrupts. And pain pattern interrupts get the pressure off of the nerves, the tiny little nerves the width of an eyelash in the knee. And when we get the little bit of space around those nerves, the joint relaxes. When the joint relaxes, it creates more space, which is comfortable. And when the joint is comfortable, it relaxes more, it creates more space. So these pain pattern interrupts are the first step that anyone with knee pain needs to take. Learning how to get the pressure off of the nerves. And once we begin to get the pressure off of the nerves, it sets up the conditions so the body can heal, because now the pain has begun to reduce. So that's the key. Now, Susan, you asked, is the knees don't always hurt. A lot of times what happens is the nervous system will up the ante. So if we feel pain, the rest of the body will tense up so we don't feel this pain. The whole body gets tighter, and then we injure something again. We feel this, and then the whole body gets tighter again, so we compensate for it. This makes the whole body kind of crank down, and when the body cranks down, it makes it more prone to injury. It makes us more prone to arthritis, because arthritis is dehydrated joints. The tighter your joints are squeezing, it's squeezing out all of the lubrication in the joint. So now the body in general is getting tighter and tighter and tighter and tighter, and then we try to do stuff like we did when we were younger, and we can't do it because the body's so tight. The key here is to begin to create pain pattern interrupts on a consistent and a regular basis. The pain pattern interrupts become the default. Instead of the Advil, the Tylenol, the Nuprin, the aspirin, whatever it is, whatever sort of drug or shot or the doctors are offering, instead of strengthening the muscles, because you just create a tighter dysfunction if you strengthen the muscles from that point, the key here is to relax. The key here is to create the pain pattern interrupts, get the body to relax and drop down and let go. And when it does that, we set up the conditions so now the body can heal itself. So first and foremost, create these pain pattern interrupts. And Susan, if you got more questions, ask. The inflammation, a lot of times, because the joint is tight, the body can't flush out the inflammation. And this is really going to tie into the next question I got, which was around, it was from Shauna, and it was around a bakerscyst that she has. Now, a bakerscyst is a formation. It's like a lump that happens in the back of the knee, just below the knee joint. So it's kind of at the top of the calf. And it tends to be very painful. And I like to refer to a bakerscyst as like a kink in the garden hose. If you've ever walked around the corner of the house, you're trying to water, and the knot that forms in the hose, what happens is the pressure is on one end of the hose, the knot is keeping the pressure from coming out of the other end of the hose, or keeping the water from coming out of the other end of the hose. So when you go to water, there's no water coming out. But the pressure is right there at the knot. So when your knee, I was talking about the pain tension loop just a minute ago, and this ties in with inflammation or bakerscyst. When the joint gets tight, it's stuck in the pain tension loop. It tenses up to protect itself. Normal, natural response to pain. However, it makes it difficult for the body to flush itself out, to clean itself out. So what happens is, now we may not have a great diet, we may eat a little bit too much sugar or something that processed that's not so great for us. We don't drink enough water, and now the body doesn't have, like, it's able to flush itself out because it's kind of goopy inside there, lack of a better term. What ends up happening is that lymph, which is the lymphatic system, is like the garbage collectors. It cleans out your body, your nervous system. It cleans the garbage out. And when we have this tension in the joint, and when we don't have like the fluid in our body is thicker because we may be dehydrated, we haven't been eating good food, what happens is this gets stuck in the joint. And it irritates the joint more, and the joint inflames. and it gets worse, in addition to the injury that's already there. So we have kind of like this perfect storm that creates this condition for the knee not to be able to heal, or the bakerscyst to form behind the knee. Now the key here, once again, is going back to the pain pattern interrupts. Going back to the example of the garden hose, instead of pulling that hose tighter, which makes the knot tighter, which makes the water still not come out of the other end of the hose, if we push the ends of the hose together, we create the loop that allows the water to flow out of the other end of the hose. And that's what we're doing with pain pattern interrupts. By creating comfort in the knee, we're getting the pressure out of the joint. We're creating space. We're allowing the joint to relax. This sets up the conditions for the body to be able to heal itself. Because now, one, it's comfortable, the pain is reduced. We've created more space, so the body is now able to flush itself out. We drink more water and we start eating better food, and now the body has the nutrition to be able to heal what's going on in the knee. So the approach is very simple and straightforward. And for Shauna, there was a client that I worked with. He was out of Utah, Park City, Utah, and had a bakerscyst, had a ACL reconstruction 8 years ago. He started the beginning of July 2016, and within 3 weeks, a bakerscyst that he had had for 8 years flushed itself out. It cleaned itself out. We had a couple of calls and really dialed in on exactly what was going on in his knee. I gave him the specific pain pattern interrupts that were able to help him with what was going on with his knee. The bakerscyst resolved in a few weeks. It was actually really cool. I remember the last conversation, it was kind of like, deer in the headlights, like I didn't really know what to say because it had disappeared. So it happened so quickly, I wasn't expecting the bakerscyst to resolve as quick as it did, which was awesome. I mean, it's great. When you rely on universal principles that the body understands how to heal itself, it will do that. And we just need to set up the conditions so the body knows what to do. We need to set up the conditions for the body to be able to heal itself and just get out of the way. That's really what it is. It's that simple. We have to keep the mind in a good place where we aren't getting ourselves stuck and doing things that are actually going to sabotage the process. So we get out of the way, let the body begin to heal, create those pain pattern interrupts on a consistent and regular basis. And what ends up happening is the body just does like some amazing stuff. Now I notice there's some people on here. If you have questions about your knee pain, you can go ahead and type it in there, and then I'll answer those. Be happy to. I am going to check online here to see if there are any other questions that have come in. Let's see. Doesn't look. Oh, wait a minute. Yeah, I guess you can write some questions in there. Like it, love it, hate it. It's okay. I've gotten all the different types of feedback. But I'm Bill Paravano, the knee pain guru. I am the best in the world at eliminating knee pain without drug shots or surgery, and I'm here to help. I'm really great at what I do. I know what's going on. I've been doing this online for the past 8.5 years, and been doing this for 18 years, since I dislocated my left knee and had reconstructive surgery on the ligament in my left knee. So if you have questions, go ahead and type them in. I wonder how I can see who is. Is there any way? This technology thing, it's cool. However, some can be a little elusive. So if there's questions, touch your live. This may take a minute. Oh, Susan. Susan's here. Hey, Susan. All right. Who else has questions? I answered questions about Susan. I'd love to hear your feedback. You were diagnosed with bone on bone. We worked. We got your knee feeling a lot better. So that'd be great if you can type in something on there. If you have questions, what's going on with your knees, pain in your body? I have another 5 minutes. I got to jump on a call here. So if we have that. Hey, Susan. Good to see you. Okay. I just had it from Anjali. Knee exercises. That's the last thing I would point anyone to do is exercises when they have knee pain. Because if we think about the concept of exercises, when you have knee pain, you have the body moves away naturally, moves away from pain to a place of comfort. So if you stub your toe, have pain in your knee, whatever it is, the body will compensate and move away from that pain. If we start to try to exercise and strengthen from a place of pain, what happens is we create a more dysfunctional pattern in the body. So I would never point someone to exercise from a place of pain. We got to get the pain reduced using pain pattern interrupts on a consistent and regular basis. You want to do pain pattern interrupts on a consistent and regular basis, get the pain level down, and then from that place of comfort, begin to exercise and just amp it up gently so the body understands and it's not coming from a place of fear. Because a lot of times there's fear when we have pain. We don't want to move in that direction because of the pain. However, if we use pain pattern interrupts, we reduce the pain. Then what happens is the body dissipates the fear and it builds up confidence. And that's really key. Okay, Susan is asking, how often can a PT get knee injections? Or a patient get knee injections? I don't know. I'm not a doctor. That would be something you would ask your doctor. I'm not a big, you'll want to play this back, but I talked about knee injections, and it's really just a Band-Aid. It's not addressing the underlying issue of what's going on in the knee. So essentially what doctors are doing is they're hoping by giving an injection that it's going to numb what's going on or hopefully reduce the inflammation in some way, so when the injection wears off, that the pain may be gone. I'm not a big fan of injections. One, I don't like needles. It's not a big thing for me. And I have gotten ridiculously great results with pain pattern interrupts, both for myself as well as thousands of clients over the past 18 years. I talked about knee exercises. Susan, you're still mostly free of knee pain. And she knows what to do if she has pain. And that's the key. That's what I want for you. Is if you have pain, to have the confidence to know what to do when your knee hurts, as opposed to taking, the conventional Tylenol, Advil, Nuprin, and that is taxing on your organs. Those are synthetic chemicals, as well as any prescription drugs to numb the pain. It isn't really addressing the issue. And I'm more along the lines of rather address the underlying issue. Let's see. I think I answered Shauna's question on bakerscyst. And the fundamentals, it doesn't matter. It doesn't matter what is going on in the knee, as long as what you're dealing with is not broken or torn. The pain pattern interrupts create comfort in the knee, set up the conditions so the knee can heal itself. Making sure you have the proper water and nutrition is going to be very helpful as well. And then on the other side of it, making sure the mindset, you're not doing things that are actually going to sabotage yourself in the process. Susan, If you want to chat, I believe you have a link. You should go ahead and set up a time. We'll talk. See how you're doing. We'll catch up. It'll be good to see you again. I believe that is all of the questions. So, share this video far and wide on Facebook. Anybody you see limping around, those would be the ones that you'd want to send it to. And yes, I'm here to help. So if anybody's got questions, go ahead and forward this video. Go to my website, thekneepainguru.com. Go to my Facebook page, The Knee Pain Guru. Also, I'm on YouTube and Twitter. Connect with me. I could help you. As long as nothing is broken or torn, make sure you go to your doctor first, get a diagnosis. Go do that. This is Bill Paravano, the Knee Pain Guru, going to sign off for now. Have a wonderful day and a wonderful rest of the week.